It's now a privilege to introduce our commencement speaker, Dr. Charlie Clements, MD, MPH, chosen by the graduating class to be their graduation speaker. Dr. Clements is a public health physician and human rights activist, widely recognized for his humanitarianism. He's currently the executive director of the Carr Center for Human Rights Policy at the Harvard Kennedy School, where he also teaches human rights as an adjunct lecturer in public policy. He was a distinguished graduate of the U.S. Air Force Academy. His experiences in Vietnam led him to a change in the direction in his life. He obtained his MD and MPH from the University of Washington School of Medicine. He's the author of Witness to War, published by Bantam in 1984, the account of his journey of conscience from being a pilot in Vietnam to being a physician treating civilians in the midst of El Salvador's civil war. He was a founding board member of the Cambridge-based Physicians for Human Rights, and in 1997 represented that organization at both the treaty signing in Ottawa and a week later at the Nobel Prize ceremony for the international campaign to ban landmines. He spent much of the 1990s along the Rio Grande River in Texas and New Mexico, assisting low-income communities without running water or sewers to construct badly needed infrastructure. When he taught at the United World College in Montezuma, New Mexico, one of his students was a young Chilean named Johann Burkholz, graduating today and one of our two class speakers. Small world. Dr. Clements?
Dean Karen Ottman, faculty, honored guests, and family and friends, and most importantly, you who are the reason we gather today, the graduates, I am grateful for the honor of addressing you this morning. Let me also thank Johann Burkholz, whom I met as a 17 or 18-year-old when I taught at UWC. Who would have thought our paths would cross again on such an occasion? Johann nominated me as the commencement speaker, and I thank you for choosing me as the speaker. I congratulate all of you on your graduation today, which is clearly not only a sign of your intelligence and perseverance, but also a reflection of your character and your ideals. It is equally an accomplishment for those who have believed in you, supported you, and assisted you along what must have seemed like a very long and at times trying path. Congratulations to the parents, family, and friends who have been there for you at some moment along the way, and especially the spouses who may even be happier today than the graduates themselves. Bertrand Russell once said, "One of the symptoms of an approaching nervous breakdown is the belief that one's work is terribly important." So permit me a moment of insanity. There's great peril in disagreeing publicly with the Nobel Prize winner, but I must. I'm a human rights activist, public health physician, and a teacher, and I do think my work is terribly important. Every day in these roles, I have a chance to stand up to human wrongs, to improve the well-being of others, and to inspire students to see the world as a place where they can give back. Whether you choose to do community-based public health work, be a primary care physician, a tertiary care specialist, or a lab scientist, I want you to know that you have similar opportunities every day. Every once in a while, I overhear someone ask, what does a physician or medical student actually do as a human rights activist? I think that question comes from the image of a human rights activist as someone storming the barricades. Well, this morning, I'm going to give you the secret handshake. Actually, it's not a handshake, it's a three-word code: dignity, witness, and hope. Let me explore each of them. Dignity is at the core of all human rights. It's where human rights began in the Universal Declaration of Human Rights, and it's where they begin with you in whatever role you pursue with the degree you receive today. The preamble of the Universal Declaration, often called the UDHR, states, whereas recognition of the inherent dignity and the equal and inalienable rights of all members of the human family is the foundation of freedom, justice, and peace in the world. And then Article 1 begins, all human beings are born free and equal in dignity and rights. Dignity should be at the core of every interaction you have with patients as a physician. There's often a lot undignified about illness, about hospitals, about standing around in one of those paper gowns we often make patients wear when they wait to see us, to being in the stirrups, to being given a wallet triage and perhaps trundled off to another facility because you're not good enough economic risk for the hospital or clinic you were brought to or came to. I'm sure you can add to the list. When circumstances, when officious attendance in Medicaid offices, when language barriers, when impairment of some kind denies people their dignity, we should recognize that they may feel stripped of their worth. And we, each of us, can restore it with a gesture, with a touch, with a listening ear, with words that restore their humanity. We should never allow ourselves to be so busy, so preoccupied, so pressured, so important to forget this. When patients are scared, humiliated, or demoralized, we have the capacity to restore their dignity and worth, even if ever so briefly. I'm convinced these fleeting moments are never forgotten. Some of you know I worked in rural El Salvador, where the communities I served were bombed, rocketed, or strafed daily by U.S.-supplied aircraft. All of us, 10,000 civilians, were all slowly diminishing due to insufficient caloric intake. There was very little medicine. Pregnant women seemed more susceptible to malaria and so were ghostly in their pallor. And I had them soak a handful of rusty nails in a glass of water, scrub those nails daily with a wedge of lemon, and then have them drink the nail cocktail, something I remembered from pharmacology class. They were fearful for themselves and for their fetuses for many reasons, but I would explain to them carefully that no matter how bad the cocktail looked or tasted, it would make both their blood strong and that of their babies. Sure enough, the women who took the cocktail daily pinked up noticeably, and other women followed suit. To hear them tell stories about my medical feats, raising the dead was the least of numerous miracles I performed, but I'm convinced that 30 years later what mattered was the dignity they experienced in our patient-physician interaction. One patient was an elderly man with arthritis who said he couldn't sleep. Of course he couldn't sleep. Most people slept on the hard ground. There were fleas, lice, scabies that seemed to come alive at night. There were random artillery shells meant to keep people off balance. There were roosters crowing every time the moon came out from behind a cloud. And in addition, he had a lot of aches and pains. I asked him what he was worried about the most, and he told me. I gave him a handful of willow bark and willow leaves and told him to boil them into a tea, drink it just before he went to bed, and then to think back to more hopeful times in his life. The acetylsalicylic acid in his willow leaves may have brought him a little relief from his arthritis, but I think what mattered the most was in his beleaguered life there was someone to listen to him for a moment. It's amazing what a minute of rapt attention can do for someone who's distressed. So I urge you never to forget the power to restore someone's dignity, if only for a moment. You might be thinking, well, I'm going to be a scientist in a laboratory, so this advice isn't relevant for me. Oh, but it is. Because it's not the patient, perhaps. Maybe it's the person who cleans your lab. Do you know his or her name? Do you know if they have children, grandchildren? Do you know where they come from? Do you know their story? Of course, you can't ask these questions outright. You might frighten them by asking them out of the blue, but gradually you can find out some of these things. You can have interactions with them that begin with dignity. Perhaps it's a woman cashier in the hospital cafeteria. Perhaps the person who helps you park your car. All of our interactions have this potential. And no, we can't make all conversations that way, but surely you will encounter someone in your professional or personal life where dignity and worth are what's needed. Let me move on to the second of the three words of the Human Rights Secret Code, witness. We can witness in many different ways. Quakers believe in bearing witness. It's why I went to El Salvador to work as a doctor among the people that the U.S. military assistance seemed to be targeting. I didn't know how to stop the war, but I could bear witness. I could stand side by side with those peasants sending a message of solidarity. But witnessing doesn't have to be so dramatic. Many people witnessed Occupy when they chose to visit the sites where people were camped out and simply engaged in conversation. They might have taken some blankets or food down. You could sign up to give presentations. You can witness merely by recognizing someone. Sometimes the homeless say one of their most difficult experiences is being invisible to the people who pass by, refusing to look them in the eye for fear it will create an obligation. Or perhaps it's because we're embarrassed not to give a contribution. That person may appreciate an honest and dignified exchange and neither want nor expect more. Maybe some of the more aggressive homeless people who ask for money are off-putting, but occasionally you can detect when someone is bereft of all dignity and really in need of the milk of human kindness, and you have a few drops to spare. As I've said, witness comes in many forms. It can mean standing up for patients who have no voice of their own. Wendell Berry once wrote, "Protest that endures is moved by a hope far more modest than that of public success, namely the hope of preserving qualities in one's own heart and spirit that would be destroyed by acquiescence." It's worth repeating. Protest that endures is moved by a hope far more modest than that of public success, namely the hope of preserving qualities in one's own heart and spirit that would be destroyed by acquiescence. Sometimes we witness because not to do so could begin the erosion of our own integrity. There are many ways to be a witness, and one is to bring awareness of others. One of the most poignant stories of witness I've encountered took place in a Warsaw ghetto, where struggling in the sewers and bombed-out buildings with practically nothing to fight with, bricks at times, about 200 starving Jewish partisans held off the Nazi battalions for weeks. During the most intense period of the bombing, torching, and gassing, on one of their few operational radios, the partisans heard mention of their plight on the BBC, and it raised their spirits immeasurably, knowing the world was aware of their struggle. That story comes to us from Marek Edelman, the commander of the young Jews who resisted the Nazis. He and a small band of fighters miraculously escaped, and eventually he became a cardiologist. But he didn't speak of that history for more than 30 years. It wasn't until the 1970s he related how that brief witness by the BBC radio broadcast had inspired their continued resistance in the face of hopelessness. And maybe that's a good segue into the third word of the secret code, hope. Hope is the very foundation of the Universal Declaration of Human Rights. The UDHR, as it's more commonly known, is an aspirational document. It was created with the belief that if government, and it is about the obligations that governments owe their citizens, fulfill their duties, then another Holocaust would not be possible. In each of the years since the UDHR was adopted by the United Nations in 1948, we have seen progress in further defining those rights, in promoting and protecting them through institutions that flow directly from the UDHR, such as the International Bill of Rights, the regional courts and conventions like the European and American Conventions of Rights and Courts, the African Charter of Human and People's Rights, the ASEAN Commission of Human Rights, the many international treaties that bind nations once they ratify them and then have to codify them into domestic law. So a treaty such as the Convention on the Rights of the Child has been ratified and become domestic law in 190 of the 193 countries of the world, signed and ratified by all communist nations but one, and all capitalist nations except one, signed and ratified by the world's only Jewish state and all the predominantly Muslim countries but one, signed and ratified by rich and poor nations, by authoritarian and democratic nations. Those that hold out are Somalia, North Korea, and the United States. But the remaining 190 countries have all agreed to a body of rights to which all the world's children are entitled, creating, if you will, an international morality of sorts. There are more than 20 such international treaties, including one that prohibits all forms of discrimination based on gender and another on race. And let me pause for a moment here because Dean Antman is probably too modest, but this medical school was the first in the nation to integrate racially in 1864 and the first to become a co-ed medical institution in 1873. Another treaty defines the right of people with disabilities. Another bans landmines, and the list goes on. They are having an impact, and they are grounded in hope. Hope that we can name, stigmatize, and eventually prevent heinous human behavior, just as we did for slavery. As Americans, we don't often know about the hopeful world of human rights. Indeed, if the only way you know about the world is through the news media that benefits from sensationalizing tragedy and profits from making us feel fearful, it may be hard to be hopeful. I cannot think of a single domain in my lifetime in which there hasn't been significant improvement. You could say, but we're involved in two simultaneous wars. And I would say yes, but the deaths of 6 Afghan civilians killed by a drone becomes international news, and the U.S. military is compelled to do an investigation. whereas thousands of Vietnamese civilians die daily with no notice or any accountability. Information technology allows us to shine spotlights into dark corners that were previously obscure and inaccessible in earlier decades. Starvation still happens, but no longer because there is insufficient food in the world. The international community would not allow 15 million people to starve to death in obscurity as they did in the Chinese famine of 1959 to 61. Ours is not a colorblind society, but the issues of race have come a long way in my lifetime when, as a child visiting my grandparents in Alabama, I saw white and colored restrooms, waiting rooms, and water fountains. We have not yet had a woman president, but when I graduated from high school, there were 20 women in the U.S. Congress, and today there are 91. The U.S. has half the nuclear weapons we had 20 years ago. Yes, global warming is looming, but the awareness of it is growing rapidly, and we will perhaps have to work more collectively for the first time in the history of humankind to resolve it. History tells us that in the long run, hope prevails. A Unitarian abolitionist minister from Boston named Theodore Parker first told us, "The moral arc of the universe is long, but it bends towards justice." His words were long forgotten until Martin Luther King Jr. made them famous during the Civil Rights Movement, and President Obama resurrected Parker's and King's words, adding an important addendum. He said, "We have to remember that the arc of the universe isn't bent by gravity, but by the courage and persistence of activists who will not settle for anything less than justice." We can honor those who made the world we inherited better if we remember progress does not occur by happenstance or accident, but by sacrifice. We need to be reminded of this from time to time and remember the people who remained hopeful in the struggles of their time. According to that great suffragette and excellent counter, Carrie Chapman Catt, the effort for the right of women to vote began at Seneca Falls in 1848 and didn't end until 1920. It involved 56 referendum campaigns directed at male voters, plus 480 campaigns to get legislators to submit suffrage amendments to voters, 47 campaigns to get constitutional conventions to write women's suffrage into state constitutions, 277 campaigns to get state party conventions to include women's suffrage planks, 30 campaigns to get presidential party campaigns to include women's suffrage planks in their party platforms, and 19 campaigns with 19 successive Congresses and the campaigns in 2/3 of the state to approve the 19th Amendment. Many of the women who were active in or led this effort died before they were ever granted the right to vote. But they didn't give up, ever. They didn't stop believing that they could and would make a difference, even as day to day they met with resistance, disdain, and violence. They didn't lose hope. I'm certain each of you has a reservoir of hope because there are 75 applicants for each person admitted to the BU School of Medicine, and similar numbers for the Allied Health Sciences programs represented by all of you today. You began this journey with hope, and I'm sure you can think back to someone who spilled a little hope on you along the way. They may even be in the audience celebrating this occasion. I believe hope is contagious. I think when you're around someone who has it, you can't help but get a little bit on you. Often, sometimes, it's as simple and easy as a smile to convey a little hope. We can convey hope to patients, to coworkers, and to those we encounter who seem to have little by believing that the arc of the universe does bend toward justice, and when we can, acting to bend it as well. So I close by leaving you with these 3 words from the secret code of human rights activism: dignity, witness, and hope. May they always be your companions on the remarkable journeys that await each of you. Thank you.